Hello, friends. How are you today? Today we'll talk a little bit about the anatomy of the foot. Let's get started. The ankle and foot. The ankle is complex joint articulating the lower extremity with the foot. It permits the flexion, extension, and rotation of the foot. The ankle bears the full weight of the body with its hands with the force applied in activities such as running and jumping. For this reason, and the ankle is subject to wide ranges of injuries. The foot. The foot is the terminal end of the lower extremities on which we stand and walk. It is articulated to the lower leg through the ankle joint. The multitude of functions of the foot is the result of sophisticated biomechanical anatomy comprising several bones, joints, ligaments, muscles, and tendons that allow for its versatility because of its role in ambulation and with bearing. The foot is subject to several pathologies that can limit our mobility in daily activities and professions. The ankle is a synovial joint formed by the bones of the lower left tibia and fibula and the bones of the foot, the talus and calcaneus. The landmarks of the lower extremity forming the ankle are the lateral malleus, suited, and the edge of the fibula. Posterior malleus on the back side of the tibia. Medial malleus in the medial lower edge of the tibia. Foot bones. The foot is equipped with 26 bones, including 14 phalange, 5 metatarsal bones, 7 tarsal bones, calcaneus, talus, cuboid, navicular, and medial mid and lateral cuneiform bones. These bones are grouped into three sections: foretooth, formed by the phalanges and metatarsal bones; midfoot, comprising five tarsal bones, three cuneiform bones, cuboid bone, and navicular bone; hind foot, comprising two tarsal bones, the talus and calcaneus. The dorsal or upper side of the foot is opposite to the lower plantar side facing the ground. Tarsal bones. Calcaneus is the largest bone of the foot, protruding at the heel. It is the first part of the foot to touch the ground when walking. This bone inserts the Achilles tendon arising from the calf muscles, gastrocnemius and soleus, in the posterior side. These muscles extend the ankle and flex the foot when resting the body on the balls of the foot. In the anterior or articular side, the calcaneus has a convex shape and faces the posterior side of the talus. Talus is the second largest tarsal bone of the hind foot. It is situated anterior to the calcaneus and is almost completely covered by cartilage due to its back articular surface. Multiple articulations are present at the talus, use the calcaneus, lateral and medial, malleoidal, and navicular bone. The talus comprises the head, neck, baby, and two lateral processes. The talus comprises the head, neck, baby, body, and two lateral processes. Cuboid is smaller bone situated on the lateral side of the foot between the calcaneus and the fourth and fifth metatarsal bones. It takes the name from its cuboid shape. It is for insertion of ligaments and forms the articulations of the following bones: calcaneus, third, cuneiform, fourth, and its metatarsal. Navicular bone is located in the midfoot, anterior to the cuboid and before the cuneiform bones. It forms part of the dorsum of the foot. The board-like biconcave shape joins the nail to this bone. Cuneiform bones. The cuneiforms are three bones named medial and lateral cuneiform, having a convex shape. They are situated in the foot dorsum. They form multiple joints. The medial articulates with the navicular first cuneiform and first and second metatarsal bones. The middle smallest cuneiform bone articulates with the navicular first and third cuneiform, second metatarsal bone. The lateral cuneiform articulates with the navicular second cuneiform, cuboid second, third, fourth metatarsal bones. Metatarsal bones. The metatarsal bones are interposed between the tarsal bones and the phalanges or tusk bones. They have cylindrical, elongated chip divided into a head distal end, neck shaft, and base proximal end. The shaft is slightly curved to provide a concave shape to the four plantar and convex the two dorsal foot sides. The first metatarsal corresponds to the phalange of the hallux or big toe. The other metatarsal bones follow sequentially with the second, third, fourth, and if in the continuity with the corresponding proximal phalanges and tusks. Each metatarsal articulates with at least one tarsal bone of the midfoot, whereas the metatarsal head articulate with proximal phalanges. The phalanges are the most distal bones of the toes, forming two rows. The proximal phalanges opposed to the metatarsal bones, the middle and the distal phalanges, except for the hallux, with two proximal and distal. All other toes have three phalanges mirroring the anatomy of the hand. Proximal phalanges present cylindrical and curved shape similar to the metatarsal bones, with the largest one being the proximal phalanges of the hallux. Distal phalanges have the flat shape to accommodate for the toenail bait. The sesamoid bones are unusual in that they are embedded into a tendon rather than being tree. The foot has two small sesamoid bones at either side of the first metatarsal bone head of the hallux, forming the ball of the foot. They have the shape of the bean and function as pulley for the tendons during motion. These bones absorb shock and exist during walking when pressure is put on the ball of the foot. The cartilage, the edges of the bones forming an ankle joint, are protected by articular cartilage. This is rubbery, shiny, and smooth tissue, which reduces the friction between bones during movement and absorbs the impact, thus preventing the degeneration of the bones. The cartilage, the edges of the bones forming an ankle joint, are protected by articular cartilage. This is rubbery, shiny, and smooth tissue, which reduces the friction between bones during movement and absorbs the impact, thus preventing the degeneration of the bones. The cartilage, the edges of the bones forming an ankle joint, are protected by articular cartilage. This is rubbery, shiny, and smooth tissue, which reduces the joints of the ankle. The ankle consists of the three distinct joints: tailored crural or true ankle joints in both the tibia, fibula, and talus. The small bone between the tibia and calcaneus bones. This joint is responsible for flexion extension of the foot. Subtalar joint or calcaneal joint is formed by the talus and calcaneus. Side rotation of the foot. Inferior tibiofibular joint or the syndesmosis joint between the tibia and fibula. The foot has over 30 distinct joints, which articulates the bones with one another. Only the subtalar and transverse tarsal joints control foot motion, inversion, and eversion. The other joints allow for small movements only. At each joint, the bones ends are covered with articular cartilage to absorb shock and create a smooth surface for the movement of the bones at the joint. Subtalar joint, synovial joint, articulates the talus and calcaneus. It allows side to side movement of the foot. Transverse tarsal joints or Chopard's joint articulates the talus and calcaneus on one side and navicular and cuboid on the other. It allows some pivoting movements of the forefoot on the hindfoot and flattening of the arch. It includes the tailored calcaneo navicular and the calcaneo nivoid joints, synovial joints, which articulates the anterior calcaneus and navicular and cuboid respectively. Cuneo navicular joint, synovial joint, between the navicular bone and the three cuneiform bones. Cuboideo navicular joint between the cuboid and navicular bones. Tarso metatarsal joints of or the Lisfranc joint articulates the distal tarsal bones, cuneiforms and cuboid, with the metatarsals. Intermetatarsal joints are located at the base of the metatarsal bones. Metatarsophalangeal joints end EP are five joints between each metatarsal pulse and the corresponding phalanges. These are visible when bending and straining to the toes and permit the flexion and extension of the toes. Interphalangeal joints are two in each toes and connect the three phalanges with one another, with the exception of the hallux that has only one. They are used when curling the toes. Ligaments of the ankle. The ankle is supported by number of ligaments, which are elastic fibrous bands of connective tissue join bones to bones. The main ligaments of the ankle are named according to the bones they connect with one another. The lateral ligament complex is the key structure located on the outer side of the ankle, consisting of three ligaments. Anterior talofibular ligament connects the talus with the fibula on the ankle front side. Calcaneofibular ligament connects the fibula to the calcaneus on the lateral side. Posterior talofibular ligament runs from the back of the fibula to the posterior side of the calcaneus. Deltoid or medial ligament is situated in the medial internal side of the ankle. Anterior inferior tibiofibular ligament keeps the tibia and fibula together on the front side. Posterior fibular ligaments keep ends of tibia and fibula together from the back side and comprise the posterior inferior tibiofibular ligament and the transverse ligament. Interosseous ligament is a large membrane that runs throughout the length of the tibia and fibula to connect these bones of the lower leg. The retinacula. The retinacula comprise a system of ligaments forming fibrous bands which support the tendons of the lower leg and ankle foot during flexion, extension, and rotation movements. Superior extension retinaculum is the higher retinaculum located in front of the lower leg. It inserts in the middle of the tibia and extends to the fibula across the ankle. It keeps together the extensor tendons. Inferior extensor retinaculum is the lower band of ligament attaching from one malleus to the other, finally attaching to the dorsal foot. Superior peroneal retinaculum and inferior peroneal retinaculum are located over the tendons of the peroneal muscles. The superior holds the tendons in position below the lateral malleus, and the inferior holds the lateral side of calcaneus. Ankle joint capsule. The ankle is surrounded by fibrous capsule enclosed by a synovial membrane, which produces a lubricating synovial fluid to facilitate the sliding of the ankle bones. The ankle capsule is held together by the deltoid and medial ligaments in the outer, later by the anterior talar fibular, calcaneofibular, and posterior talofibular ligaments. These structures together permitted a wide range of movements of the ankle joint and stabilize the ankle to avoid excessive extension, flexion, and rotation. The bursas. The bursa is an important structure of the ankle joint. It's a fluid field acting of the cushion to absorb shocks and lubricate the joints with dense fluid. There are three bursae in the ankle joint. Subcutaneous bursa of medial malleus is found between the medial ligament and the median malleolus. The distal edge of the tibia, it facilitates the dorsoflexion and plantar flexion. Two bursacs are located in the inner and outer aspect of the Achilles. They are the ret- retrocalcaneal versat lies between a Achilles tendon and the posterior side of the calcaneus and protects the Achilles from injuries. Subcutaneous calcaneal versat is located superficially under the skin of the calcaneus bone, adjacent to the soft tissue of the heel. There are four versaps in the foot. Metatarsal versa is located at the base of the toes under the metatarsal bones, just about at the balls of the foot. Intermetatarsal versas are small versas located between the toes metatarsal bones. Metatarso phalangeal versa is located on the inner part of the foot laterally to the hallux enlarged in bunion. Calcaneal bursa lies under the calcaneus bone on the foot and above the fat tissue of the heel. Muscles of the lower leg. Muscles of the anterior lower leg controlling the foot. The movement of the movement of the foot is controlled by muscles situated in the lower leg, also named extrinsic muscles, as well as muscles residing in the foot itself or intrinsic muscles. The anterior parts of the lower leg shin comprise the following muscles: tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. These muscles dorsoflex the foot and toes upward. The tibialis anterior also controls turning the foot inward. Muscles of the lateral side of the lower leg. Peroneus longus, peroneus brevis. These muscles are used to pull the foot out upward and flex the toes, pointing the foot. Muscles of the posterior lower leg. The posterior compartment of the lower leg, commonly named calf, consists of the large muscles gastrocnemius soleus. The gastrocnemius begins on the femur above the knee, whereas the soleus inserts below the knee at the tibia. These muscles merge as they descend towards the ankle to form the Achilles tendon, which wraps around the calcaneus of the heel bone. The calf muscles flex the ankle and lift the heel when resting the body on the ball of the feet. In the deep posterior compartment of the lower leg are the following muscles: tibialis posterior, flexor digitorum longus, flexor hallucis longus. The tibialis muscle pulls the foot inward, and flexor muscles flex the toes, and hallux, respectively. Together, they also control the flexion of the foot plantar. Muscles of the foot. The largest muscles of the foot are mostly located on the plantar side and distributed on their layers, which are described below from the inner to the outer layer. First layer originate at the calcaneus and extend up to the toes. Ab- abductor hallucis and abductor hiatus minimi muscles contribute to the abduction of the hallux and small toe, respectively. However, however, their function is mostly to relieve the tension in the plantar aponeurosis when you lift the toes. Flexor digitorum brevis muscles insert as the remaining four toes and flex them. Second layer. Quadratus plantae araxis from the calcaneus and joins with tendon of the muscle flexor. Digitorum longus lumbricals 1 to 4 connect to its lateral toe, except hallux. Back insert to the proximal phalanges. They are used to flex two toes. Third layer. Flexors hallucis brevis runs from the cuboid and lateral cuneiform bones the proximal phalange to flex the big toes. Toe. Flexor digiti minimi brevis veins at the fixed metatarsal and inserts in the proximal phalange of the lead toe and its looks for its flexion. Adductor hallucis originates in the second, third, fourth metatarsal bones and connects to the proximal phalanx of the hallux. Four layered. Plantar and dorsal interossei begin of the metatarsal bones and insert in the proximal phalanges. They are looked to adapt and adduct the toes, respectively, extensor digitor brevis and extensor hallucis brevis muscles, joins to form and muscle and run from at upper lateral part of the calcaneus to proximal phalanges of the toes and are used extend them. Tendons on the ankle and foot. The functions of the muscles of the foot is coordinated by numbers tendons connecting the muscles to the bones. These tendons begin in the lower leg and descend to the foot, where they assist in the movement of the toes. Peroneal or fibularis tendons, longus and brevis, run behind the fibula along the lateral side of the calf to the foot. These tendons are named after their corresponding muscles. Peroneal brevis, short tendon attaches to the fifth metatarsal bone of the foot, lead toe. Peroneal longus long. Tendon runs under the foot and inserts to the first metatarsal bone of the foot. The extensor longus digitorum and extensor hallucis longus tendons are the continuation of the muscles carrying the same nerves and extend to the foot and toes. Extensor longus digitorum longus arisis of the tibial condyle runs along the lateral side and inserts as the dorsal foot. It divides into four branches and inserting in the small toes. Extensor hallux longus inserts on the dorsal side of the big toe and extends it outward. It is clearly visible with foot and hallux extension. Flexion. The posterior tibial tendons arises from the calf muscles. It runs on the back side of the legs near the Achilles tendon in bends at the ankle to insert to the bones on the inner foot. It holds the arch and supports the foot when opened. Peroneal tertius tendon enters the dorsal surface of the feet metatarsal bone. Achilles tendon. The Achilles tendon is the largest and strongest tendon in the body. It connects as calf muscles the back of the foot, or calcaneus is the it is also named the calcanean tendon. This tendon is formed conjointly by the gastrocnemius and soleus muscles of the calf and inserts into the calcaneus. With the flexion of the calf muscles, the Achilles tendon will raise the calcaneus. This movement occurs when in stand on our toes or during running, sprinting, and jumping due to the poor blood flow. All tendons, including the Achilles, are prone to injury, causing tears and severing. The retinacula. The retinacula are actually a system of ligaments forming fibrous bands which support the tendons of lower leg and ankle foot to keep them in place during flexion, extension, and rotation movements. Superior extensor retinaculum is the higher retinaculum located in front of the lower leg. It inserts in the merge of the tibia to the fibula across an ankle with the faction to keep together the extensor tendons. Inferior extensor retinaculum is the lower band of ligaments attaching from one malleolus to the other, finally attaching to the dorsal foot. Superior peroneal retinaculum and inferior peroneal retinaculum are located over the tendons of the peroneal muscles. The superior holds the tendons in position below the lateral malleolus and the inferior holds them at the lateral side of the calcaneus.
Arteries and veins of the ankle and foot. Arteries. The arteries supplying the ankle and foot arise from the arteries of the thigh and lower leg. The popliteal artery originates from the femoral artery in the thigh and branches below the knee into the anterior tibial artery, posterior tibial artery, and the fibular or peroneal artery. These arteries supply the frontal, medial, and lateral leg, respectively. The anterior tibial artery runs through the entire length of the leg into the foot, where it becomes the dorsal pedic artery used to feel the pulse on the foot dorsum. The dorsal pars artery supplies with the branches the dorsal side and the sole of the foot. In the dorsum, it forms the lateral tarsal artery, the arcuate artery, and the metatarsal arteries. which further divide into plantar digital arteries to supply the lateral toes. The posterior tibial artery descends through the deep posterior compartment of the lower limb and supplies the inner leg. It can be felt at the poles of the medial malleus dinuestrin in the front, the medial and lateral plantar arteries of the foot. The fibular artery runs between the tibia and fibula and divides further to supply the posterior side of the heel reticalcinium. Reticalcinium or the calcaneal anastomosis consists of the nectar of Apteris or the calcaneus, formed by branches of the fibular and posterior tibial arteries and branches of the malleolar nectars. These look arteries. This is medial plantar artery and anterior tibial artery and dorsal pedal artery, dorsal digital arteries, dorsal metatarsal arteries, arcuate artery, lateral tarsal artery, fibular artery.
Veins. Dioxy- Deoxygenated black flows through the veins from the lower extremities and ascends to the heart. The main veins of the foot and lower leg are digital veins exit from each toe and join into the plantar venous arch, which divides into each side of the foot to merge into the posterior tibial vein. Lesser or small saphenous vein originates at the foot and runs subcutaneously along the medial aspect of the calf to merge with graded saphenous vein in the thigh. Podpreter and is located posteriorly in the subcutaneous region of the knee and continues upstream to merge with the femoral vein. Anterior and posterior tibial veins and the fibular or peroneal vein run along the anterior and posterior side of the tibia, respectively. Veins plantar pump. The plantar pump is composed of large medial and lateral plantar veins. Plantar veins venous arch, which converge posteriorly into the deep tibial veins and anteriorly into the anterior tibial veins. The function of the plantar pump is to decrease hydrostatic pressure and pump venous blood upstream towards the lungs where it becomes oxygenated. This is facilitated during motion and wet burn. Common fibulary nerve. The common fibulary nerve or common peroneal nerve originates from the tibial nerve and bends around the proximal fibula subcutaneously, which makes it prone to injury. At the fibulary head, the common fibulary nerve bites bifurcates into the superficial and deep fibular nerves. The superficial tubular nerve is situated on the lateral aspect of the lower leg, where it controls motor function during outward movement. Inversion of the foot. It also provides sensory functions in the anterolateral compartments of the leg and the dorsum of the foot. Injury due to this nerve impairs the motor and sensory functions described above. The defibrillator nerve runs in the anterior aspect of the lower leg along the tibial artery. It confers motor functions to the frontal muscles of the leg to control foot dorsiflexion and tooth extension. It also regulates sensory innervation between hallux and second toe. Injury to the vestibular nerve causes the so-called foot drop and deficits in the functions described above. Thank you for watching. I hope you enjoyed learning about the anatomy of the foot and ankle. See you next time.